People out there struggling to deal with Social Security Administration, making sure they're getting their retirement benefits in time, making sure they're getting their survivor benefits, making sure they're filing for the right benefits. And there's a brand new, and a lot of my regular viewers here know about this, but there's a brand new perk out there that helps you navigate the bureaucracy. And I'm going to talk about that today and why you need to take advantage of that and how it can help you. This is also a live Q&A, so I'm going to talk about the kind of the topic of the day. Should take about 5 or 10 minutes, and then I'm going to open it up for questions. So if you got anything, questions or anything, retirement, disability, survivor benefits, spouse benefits, anything like that, make sure you type your questions in chat. Looks like we already got a bunch of questions down there, and I will get to as many as I possibly can. So who is this video for? This video, oh, my name is Ed Weir. I ran the third busiest Social Security office in the country. And by the way, happy Veterans Day out there. Marine Corps birthday yesterday. I'm old Marine Corps sergeant, so I wish you all Semper Fi, Hoorah, Devil Dogs. Today, veterans, everybody gets their fair share of awesome thumbs up, all the vets out there. All right, so this video is for the vets and everybody else out there. So if you're about to file for benefits, Social Security, survivor benefits, disability, Medicare, Medicaid, whatever the case may be, if you're currently getting benefits, this is videos for you to make sure you're getting the correct amount, make sure you will get the correct amount, to keep you up to date on any type of strange letters. Social Security always has a tendency to send out some weird letter randomly and doesn't usually come in English, legalese, Social Security bureaucratic English. So if you have a hard time trying to figure out that, then this is definitely the place for you. And this is for all the people that want to keep up on all of the changes that are coming down the pike. Regardless, doesn't matter who won the presidency, there's going to be tons of changes going forward because the Social Security Trust Fund is running out, and we need to do something to address that so we don't get a benefit cut. The benefit looks like it's going to be cut within the next 8 years or so, 2034, 2035, anywhere between 17, 20, 33%. So we have to do something quickly. All right. So the problem, all the people receiving benefits or about to receive benefits, is they don't have any help out there. That's the issue. I don't know if you've called the Social Security Administration recently, but after a 3-hour wait, they might hang up on you. The Social Security is understaffed. It's the worst staffing in 30 and 50 years. I've seen Martin O'Malley, the commissioner of Social Security, give out different numbers, and sometimes it's the worst in 27 years, it's the worst in 50 years, but I guarantee 100% it's going to get far, far worse going forward. I'm not sure you heard about 76 million baby boomers from 1946 to 1964. They are retiring. So yeah, the staffing is going to get terrible. And Social Security employees, they can't really give you strategic advice on what you should do in terms of should you file for retirement or you should file for disability, or maybe retirement and disability and survivor benefits. You pretty much have to know what you want before you get in there, because number one, they're understaffed. And so they've got 400 cases, besides yours on their desk. I know I'm the one that used to assign those cases. And so their help is very, very limited. The people at the front windows and the people that answer the phones, they're the hardest working people at Social Security. They're also the least paid, and unfortunately, they're generalists. They're not experts. And quite often, as we've seen in this channel on my live Q&A, people get the wrong information all the time. So where else can you go for help if it's not Social Security? You can ask your tax advisor. They know taxes. They know the IRS. They do not know the Social Security Administration. I've tried to help so many people that their tax people gave them the wrong information on Social Security. Can you go to a lawyer for help? No, you can. Most lawyers don't touch Social Security unless it's a Social Security disability claim. And if you win, they charge you. Next year, it's going to be $9,200. So if you got a few $1,000s sitting around, then lawyer possible. Financial advisor, same kind of with the tax type of lawyer. They'll provide investment advice and maybe try to sell you an annuity or whatever the case may be, charge you a bunch of money. There are some financial advisors and others that provide you this break-even analysis. There's a bunch of companies that wrote this program, and it gives you all this fancy break-even analysis if you file this time and spouse benefits and all that. I've seen pretty much everyone out there, and it's kind of like economists. They say all other things being equal, well, life is about You know, life is what happens while you're making other plans. So you pay two, three, $400 for this, 30-minute, an hour consultation, and they come up with this cool break-even analysis, and you look at it for 2 minutes, and they're in my estimation, they're just a waste of time because you don't know when you're going to pass away. If you knew that, I can tell you 100% when you should start your benefits the day you pass away. So everything else is just a guess. And there's so many other variables. Are there going to be spouse benefits? Are you going to have any children benefits on the record? Are you going to have any other tax liabilities? Are you, health in your family? So there's too many variables. Are you working? There's also Medicare insurance agents that try to provide Social Security advice, and please stop. There's a company out there, educational institution, that you can sign up a few $1,000s and become a Social Security expert after a couple of days of online training. And you get a cute little certificate, and you get a little acronym type thing and John Smith, Social Security expert advisor or something like that after 2 days. And they go out there and do their seminars, and please stop. They're just giving out way wrong information, and they're do the seminars in order to get you in to enroll you in Medicare and stuff. And okay, that's fine. You need to get enrolled in Medicare. You need help with that, but please stop the providing the Social Security advice. If anybody provides you Social Security advice like that, first question is, so how many decades did you work at Social Security? How many claims did you actually adjudicate? How many hundreds of thousands? How many millions of people have you helped? And if they can't answer those three questions, then you need to go on someplace else. And one of those places is the PERK. I am no longer with the Social Security Administration. I worked there for decades. I have talked to millions of people about their Social Security. I've adjudicated hundreds of thousands of claims. I'm no longer muzzled by the Social Security Administration. That's one of the things that Social Security employees, they can't provide you kind of strategic financial advice in that respect. They can't, they know some of the stuff, but some of the stuff they can't tell you, whether you need a lawyer and what should do and stuff like that. And so they can't give you the tips, tricks, and secrets. And that's what I am doing here. I've got over 800 videos already out there on all things Social Security. And I do a live Q&A, which make sure you type your question into chat. If you have a question today, I can help you out with. And yes, I do have a partner because I help with Social Security, retirement, survivor benefits, spouse benefits, disability, Medicaid, but a lot of people also need help with Medicare. So I have looked throughout the country, and I have come up with a partner chapter Medicare if you need help with Medicare plans, Medicare Advantage, Medicare supplements, Part D plans. Call them up or don't. It's completely up to you. But I've looked for every company in the country, and these are the guys I've chosen. And they provide 100% free health. So give them a call if you want to. And if you do happen to give them a call, please, please, please let me know. I'm going to keep I've interviewed dozens. My son and I have interviewed dozens of companies throughout the country to help y'all with your Medicare. And these are the guys that knocked it out of the park so far. 100% perfect reviews. But I'm going to keep an eye on them. And if they don't do their job, I will find someone else. But right now they're doing an outstanding job. So if you need help, reach out to them and let me know how it goes. Please, please, please. All right. And 99.9 chapter Medicare, their help is free. The live Q&As are free. The videos are free. Yes, you have to deal with YouTube's commercials, but but I do a very, very limited amount of private calls to pay for, the help my son gives. He's got to pay his rent, and phones and computers and all that kind of stuff. But so I do just a few a week, and I do charge for those to pay for everything else. But all the other help, 99.9% of my help is free. But if you want a private call, most of the questions I can ask during the live Q&A. So most people don't need a private call. But if you want one, go for it. But I do need a favor. This PERK is out there. I'm here. I'm going to be here. Here's an old Marine Corps sergeant. This is my new mission of life. I'm going to be here as long as humanly possible. My hairline will continue to recede over the years, but I will be here. But I need a favor from you. There are too many people out there that are not receiving the benefits they're entitled to. Way too many people are going to do the wrong thing, file for the wrong claim at the wrong time, and they're going to get the wrong benefits for the rest of their life. We need to make sure we stop that. So my favor to you is please share with your friends, family, coworkers, anything you learn here. If it doesn't apply to you, perfect. That means you did everything right. But I guarantee there's someone around you that needs help. So please, let's help everybody around you. So that's my favor from y'all. Okay, let's go ahead and jump into the questions. All right, Kimberly was told I could make up to $1,550 during there's 36 months without benefits being stopped. You said they flagged that. She said I could make that and keep my benefits. What's up? Okay, so the TTW is the ticket to work. So Kimberly's on disability benefits, and she reached out to Ticket to Work, and there's an organization that Social Security contracts with to help people ticket to work, to see if they can work, because it helps everybody out. It helps people on disability if they're able to go back to work, work through their disability, or if their disability has been improved, and it helps the Social Security Trust Fund, and it helps everybody, right? So they do everything they possibly can to help you back to work. And the person at Ticket to Work was 100% correct. You can make up to $1,550. What I recommend, based on my decades of experience, is I would stay about $100 or $200 under that on a consistent basis. The reason is because if you make $1,549 for months on end, it's got a red flag. They're going to say, wow, this person knows the legal limit, don't they? And they're just working right up to the legal limit. Sounds like, they could probably work another few dollars if they wanted to, but they know the law. So maybe we take a look at that and see if this person is actually able to go back to work and can work and make $2,000 or stuff, but they just choose to work right up to the limit. So sure, absolutely. You can make $1,550 under that and you're good. But from my experience, it's good to stay a little bit under that. Barbara, how do I renew my password to get into Social Security? It's been locked for years now, and I would like to know. Yeah, that's par for the course for a lot of people. If it's been locked for years, Social Security just came out with you probably got a bunch of emails, to check your the ID me and my Social Security, and so there's two ways you can verify it. But if it's been locked, then you have to go through the whole procedure. You go in there, and then there's you do like a video remote thing where you have to show them your ID and stuff like that. Yeah, you just have to go through that procedure. But it is good to get this done, because when you set up a My Social Security account online, it's far more difficult for someone else to go in there, pretend to be you, and start causing you trouble. So it's a good idea, definitely, to set one up, even if you never use it. Use it one time and don't use it for years. But I do recommend everybody in your family set one up and check your earnings record, because that's how they determine your benefit amount for the rest of your life, is based on your high 35 years of earnings. And if your earnings record is incorrect, you're going to get the incorrect payment. And so how this works is when you file for your taxes, you send it to your buddies at the IRS. Okay, not buddies. Okay, whatever. And then the IRS notifies Social Security how much you paid, how much your earnings were and how much you paid FICA taxes and stuff like that. And then Social Security uses that to calculate your retirement benefits and spouse benefits for your spouse, and survivor benefits or disability or whatever the case may be. And if those earnings somehow between you and the IRS and Social Security, someone typed in something wrong, then you're going to get incorrect benefit for the rest of your life. And if you don't catch it until 5, 10, 20 years later, it's way, way, way more difficult to check it or to correct that benefit amount. So, all right. And thank you for service. Thank you for service. Yes. Thank you, everybody. Please, everybody. Yes. If you worked the first of the year and started your retirement benefits in September, are you supposed to file Social Security amount on your taxes? Yeah, I don't do taxes. So, I mean, I do taxes personally, but I didn't work at the IRS. So I'm going to practice what I preach. And if I don't have decades of experience in an organization, I'm not going to give you, advice from that organization. So let's see here. Thank you very much for your help. I am learning so much from this podcast. All right, you're welcome. Thank you. It's learning so much from the podcast. Yeah, I also publish these on the YouTube podcast. They got to do it someplace else, but I'm terrible at that type of stuff. Um, my wife and I have both earned our, oh, number one, back to you're learning so much. So go out there and share that information. I guarantee you'll change somebody's life. Um, let's see, my wife and I have both earned our 40 credits. We would like to retire in Japan. I'm in Japan. I'm a US citizen, but my wife is Japanese. While living in Japan, can she continue to receive Social Security benefits after I die? Yes. もちろん、絶対もらいます. Yes, I speak Japanese, so totally give me a call. I won't. Yep. So, yep, it's no problem. So, Japan has a totalization agreement with the United States. Some countries do, some countries don't. But there's a website you can go on, an app, a application Social Security built. So you type in payments abroad screening tool, and it'll tell you, it'll ask you questions. Are you a citizen? If you're a US citizen, you live anywhere in the world and collect benefits, except for North Korea and Cuba. But if you just have a green card, then it'll ask you, do you have a green card? Are you currently receiving benefits? What country are you going to be in, and all that kind of stuff. And it'll tell you whether you can continue benefits. But in case of Japan, yes. I am now 64 and been on disability since 2008. Will I keep getting disability income as my Social Security retirement income? Do I need to contact them 3 months prior to 65 to set up retirement? Nope, you're good. Basically, what happens is if you're receiving disability benefits, once you hit your full retirement age, your disability benefits are automatically switched to regular retirement benefits. Most people don't even know the difference, because the check amount stays the same, direct deposit date stays the same, but you're now free. It's not at 65 though, it's at your full retirement age. So you're now free. You're no longer receiving disability, so you no longer have disability, limitations in terms of work. You no longer have the continuing disability review, so you can do whatever you want. Social Security doesn't care. One thing I do recommend at 65 is in most states of the country, once you're on disability for 2 years, you get Medicare. In most states of the country, if you're under 65, you can only get a Medicare Advantage plan. If you wanted a Medicare supplement plan because you don't like, you wanted to avoid the prior authorizations and the networks and all that kind of stuff, but you couldn't get one because you're under 65, well, guess what? Now you're 65. Even if you're on disability, they don't care about pre-existing conditions. So whatever your disability is, no relevance whatsoever. They cannot deny you a Medicare supplement plan because of any disability. So once you turn 60, if you're on disability, once you turn 65, a few months before, check to see if if you do want to switch to a Medicare supplement plan. Those are the ones I do recommend. I always recommend Medicare supplement, plan N first, plan G very, very, very close behind, and then Medicare Advantage. Unfortunately, a lot of people can't afford the Medicare supplement, so they get a Medicare Advantage. It's better than having just A and B alone. But there's, you really have to keep up on a Medicare Advantage. And that's why another reason I chose Chapter is because most organizations out there just sign you up and then they kind of forget about you. Chapter has what they call it, the member success team. And I just had Alyssa from the member success team last week answering all the questions, all the different stuff she asked. They help with finding a doctor and, doing appeals and finding, explaining the tiers of the prescriptions and all that kind of stuff. So that's why I chose Chapter, because they have that awesome customer service. Or in Japan, they call it omotenashi. So what's the person beyond the front desk or phone answer person that I need to ask for that knows what they're doing? CRS or something? Yes. You said some letters that are actually people with accurate info. So yeah, that's one of the issues. Is that in most offices, over 1,500 Social Security offices, well, in every office, the breakdown is, the CSR, customer service representative. Those are the people that pick up the phones and are at the front windows, and they're generalists. In order to talk to a specialist, which is called a CS, a claim specialist, either a Title II or a Title 16. Title II is the Title II of the Social Security Act that covers, retirement benefits, Social Security disability insurance, survivor benefits, spouse benefits. And then the other part of the office we're called Title 16 CSs, Title 16 and Title 16 of the Social Security Act. That's SSI, Supplemental Security Income. You get SSI based on disability or being aged, 65 and older. The problem, Lori, is it's difficult to talk to the CS, the specialist, without an appointment. And the offices don't give you an appointment until you're actually filing a claim. So if you have some type of issue, unfortunately, you're going to have to go through the gatekeeper, I guess, the claims, the customer service representative, try to get your issue resolved. And if for some reason it doesn't, then you file a request for reconsideration or ask to speak to a supervisor or whatever the case may be. And that's one of the problems with how the system is kind of organized. And that's why y'all got me here until further notice, I guess. Life is what happens while you're making other plans. Married 10 years, ex on Social Security. I'm turning 65. My Social Security would be more than his. Was told I can collect on his at my full retirement age if he has passed while I delay mine. Is this correct? Yes. So if you start your benefits, then you can collect spouse benefits, but yours is more. So, well, if yours is okay, yours is going to be more. If he passes away, for anybody out there that has a deceased spouse, you can collect surviving spouse benefits, widower benefits, same thing. You can collect surviving spouse benefits and don't touch your own. So this is one of the strategies that unfortunately Social Security employees really, they don't go into detail. You come in for survivor, and then you come in for one, and that's what they give you, unless you know what you're asking for. So surviving spouse benefits, you can file for surviving spouse benefits. Don't touch your own, and let your own increase until your full retirement age or 70 years old or whatever the case may be. Or it depends on the numbers. Maybe you're 62 years old and your benefit on your record is not very much. But if you collect surviving spouse benefits, it's reduced to 71.5%. And you're like, well, I want my survivor benefits to be available for the rest of my life at a higher amount. So you can go ahead and take benefits on your own record and then let your survivor and spouse benefits, they're not going to increase based on the person's record because they're deceased, but they'll be increased because you're delayed. You're waiting till your full retirement age and you'll get up to the full amount. So Karen, husband passed at 49 in 2015 and was on SSDI. Married since 2001. My age is 65. FRA is 66 in 2 months. Is there a rib? Do I have to wait to FRA to receive 100% of the survivors? I can start now. So married since 2001. So yeah, if you remarried after the age of 60, you're good. If you remarried before the age of 60, you cannot receive those survivor benefits. If you're still married. But in generally, you receive up to 100% of the survivor benefit, the longer you wait up until your full retirement age. Do you think Congress will vote to overturn the GPO and WEP this week? I certainly hope not. I did a video on this and got a lot of flack from those state, local, federal, some city workers that get a non-covered pension, that they're getting extra than that wasn't intended to them, and that, yeah. So I don't think it. I personally don't think it should be overturned. Anyway, I got my Medicare started with Shannon at chapter yesterday. All right, heart. Okay, so I guess that was an excellent review. Perfect. I like it. Good deal. Thank you for letting me know. Thank God for you doing these. FYI, chapter did a wonderful job helping me get the right Advantage plan. All right, another one. All right, perfect. Thank you. At 65, filed for and collected Social Security retirement. At 66, found out FRA was actually 67, not 65. Yes, and withdrew my claim, but could not repay the benefits I'd received. At 67, I cannot get benefits. What now? So yeah, to withdraw, you can withdraw your claim within 12 months of filing it, but it's not a complete withdrawal until you actually pay back the benefit. So you never withdrew your application because you didn't pay back the benefits. So your claim was still active. But at 67 cannot get benefits. No, you can get benefits. They're just in suspense because you or working made over the full benefit amount, or they're in suspense for some strange reason. They shouldn't really be in suspense for anything other than work. So you just need to reach out to them and say, "Hey, restart my benefits. I'm my full retirement age," and they'll just restart your benefits. So started on early Social Security, then SSDI was approved. Social Security has refigured my benefits 4 times and decreased the amount. Started during COVID. Can I complete audit of my account from Social Security? Yes, absolutely. So basically, if you are on retirement benefits and then you file for disability and your disability is approved, your disability amount is basically what your benefit would be at your full retirement age. They give you your full benefit amount. But Tweety Bird was receiving X amount of benefits from retirement early. So they kind of offset that. And sometimes they don't do the calculation correctly. So yeah, you can request an appeal to SSA 561 and say, hey, I want a full accounting and to make sure my benefits were calculated correctly. But I warn you, those calculations are not done at your local district office. Those have to be done at the regional office, and they take months to get back. Okay, yeah. Can chapter help with ACA marketplace? No, unfortunately. If you go on to my website or click in the description below, it says more help, and you can click on a thing under 65 health insurance. And I've got a partner in Texas that does, as of now, about 17, 18 different states on the Affordable Care Act. I'll have them give you a call, but we'll see the Affordable Care Act here in the future. Cindy, I live in Texas. I've been on Social Security and Medicare for a minute. My question is, if you have WellCare, a second provider, will that also be, and how long will it take for all this crap to get into? Yeah, if you just started it, this is the annual enrollment period. So between October 15th and December 7th, this is the time. There's close to 2 million plans, Medicare plans that were canceled, 2025 plans. And I guarantee there's hundreds of thousands of people out there that don't know they've been canceled, or that they've been downgraded to such an extent that they would cancel it themselves if they just read the fine print, or millions more. Your health insurance company were like, oh, should we cancel this person? We're not making any money from these people in this part of the country. Let's just go ahead and cancel it. But in this part of the country, we are making a little bit of money, but let's go ahead, instead of canceling it, we'll cancel that plan and we'll just move them to another plan. And we won't ask them, we'll just move it. We'll just tell them after we did it. So any of those scenarios, it's good to take, just to spend an hour out of your life calling up chapter, and they work the entire country, and they'll give you 100% free review of what's available in your area. And if your plan that you have been assigned or whatever is the best plan for next year, then you're good. You don't have to do anything until next year. And call them again, I guess. I had an appointment with your old company today and signed up for a plan and a drug plan. Thank God. Okay, perfect. Yeah, that was working with another one, but they're great, but they're small, and I just got tons of people that needed help. So I needed to get it. I needed to find a bigger organization to help y'all, and that's how I came across chapter. I get Survivor Social Security with it. Protect me from a full CDR. Oh, okay. So you get survivor benefits and you also get disability. No, it won't protect you from a full CDR. CDR is a continuing disability review so this is a good opportunity to share this information. Thank you, Ice Blue, for bringing this up. So Ice Blue is, because it mentioned CDR, he or she is getting disability. And after being on disability for 24 months, you get Medicare. So a lot of people on disability and Medicare, they don't want to mess with their disability and get extra benefits, survivor benefits, spouse benefits, divorce spouse benefits, or whatever the case may be, because they think they'll lose their Medicare and their disability and therefore their Medicare. But Ice Blue knows that's not true, because he or she has disability and probably Medicare and survivor benefits, but wants to know whether, because receiving survivor benefits, whether he or she's going to get a continuing disability review. And the question is, yes, you can still get one of those because you are in fact still getting disability. So 1550 per month or per year total. Yeah, the $1,550, that's substantial gainful activity, um, is per month. And next year, SGA is going to be $1,620, substantial gainful activity. Divorced, have to wait another year for spousal support. I need medical help. Can I get Medicare, or do I have to wait another year for spousal support? So is this one of those where your ex has not filed for benefits yet and you are super, super smart and know that doesn't matter? However, you do have to wait 10 years or 2 years. That's the independently entitled divorce spouse benefit. So yeah, if that's what you're talking about, but if your ex-spouse um, filed for benefits, you don't have to wait the 2 years. But in terms of Medicare, um, if you're 65, you can get Medicare. You can get it based on your own record. Yeah. So, but if you're not insured for benefits on your own record, then you still kind of have to get Medicare. If you don't, they're going to penalize you 10% for every 12 months you go over, unfortunately. She can use ID Me to verify who she is to get Social Security account. Yes. Yeah, I went through it just to kind of play around with it. And it was kind of, yeah, the guy that was doing my remote checking, he was pretty much sleeping there the entire time. I guess it was like early in the morning there. So thank you for your service, sir. Also, a question about the fixing of your record. How would you go about doing that if it's been years? Okay, so good question. So the earnings record. So if you find a mistake, let's say you worked in a company in 1982 and you look at your earnings record and it said 0 for 1982. So the first thing is maybe those earnings are in what's called a suspense file. Social Security has a suspense file with billions of dollars of earnings over the decades and decades and decades, with basically somebody fat fingered a Social Security number 1 2 instead of 2 1 or something. And those earnings are sitting out there in limbo in a suspense file. So the first thing you do is contact Social Security and say, hey, my earnings for 1982 are 0, but I worked for the same company the year before and the year after. And they can look at the suspense file. They'll look on it based on your EIN, the company EIN, the employer identification number. And they'll see in the suspense file whether there's any money out there. And oh, here it is right there. It looks like somebody typed in 1 2 instead of 2 1. It's got your name on in there. It's 1982. So they pull it down, stick it in your record, stick it in your account, in your record. And then if that increases your benefit amount, they'll increase your benefit. If you've been on Social Security retirement for 20 years and you get that thing corrected, they'll increase your benefit for that 20 years and give you a nice little, back payment check. So, but if it's not in the suspense file, then you have to provide some type of other proof, taxes or, whatever the case may be. But there is a kind of a limitation on timing, 3 years, 3 months, and 3 days. It's weird that they did it that way, but there's so many exceptions to that. It's not even funny. So I did not receive notification on my Social Security account online when I received a CDR notification in the mail. Is that the way it's supposed to be? Um, yeah, the Social Security is trying to update. They're kind of Luddites. They're trying to bring their system into the 18th century, and yeah, so it doesn't work perfectly, particularly in that type of situation. So, why are you trying to scare folks based on the election result? Not. Yep. I'm bringing to the attention things that possibly can be out there that we need to watch out for. And people say, "Well, don't tell us until it's already done." I'm like, "Well, then it's already done." So I think it's too late then. The horse is out of the, yeah. Anyway, I waited 7 months to file for Social Security due to death of my mother and deep depression. Can I get a back payment? Thank you. Yeah, it's if you waited, if you had called Social Security at that time and set up an appointment and say, hey, I want to go ahead and do it, then you're protected for when that month you called. But if you never really called, yeah, unfortunately, it doesn't hurt to try. So if you've got your benefits and on the decision letter, it says, here's how much we're going to pay you. It's going to be effective, yada, yada, yada. And at the very bottom, and it says, if you disagree with this, you can file an appeal. It's a request for reconsideration. And, maybe I've never seen anything like that be approved, unfortunately. Again, unless if you're past your full retirement age, they might be able to go back 6 months. If you call them at any time, then they can go back to that time when you called them, possibly if they what they do is if that is an open lead. So happy Veterans Day to all of your service. Yeah. Happy Veterans Day for everybody out there. I am 62, can get 1,000 monthly Social Security at the full age 1.1600. Divorced husband will get much higher Social Security. Can I start with mine and then switch to his when he is his full retirement age? No. You have to file for benefits on your own record. The strategy you're talking about ended in 2016. File and suspend and all that. So right now, to start benefits on his, you have to start benefits on yours first because he is still alive. So he is still alive. In Florida, people should also consider the high deductible G, $150 less per. Yeah, I often drop the ball on that. I don't talk about the Medicare Part G. There's a high deductible plan that's the monthly premium is a lot cheaper. It's just that everybody I've talked to that after the years, it's a deductible of about 2,900. It's going up a little bit next year, and that's fine. You save money now, but everybody I've talked to 5 or 10 years later, they stop going to the doctor because they don't have that extra 2,900 or 3,000 or 3,400, whatever it is in the future, and their health kind of suffers for it. And so maybe a tad bit more. Yeah, I don't know. It's you save $150, and if you sock that away, then it would take care of it. But life is what happens while you're making other plans, and that money is used. So, but yeah, that is a fair plan, a high deductible. So you can reach out to chapter and they can see if one is available in your area. But just make sure you have that money and don't let your health suffer because you can't pay the deductible and stuff. So I hope everybody is well, considering LOL anyone now that I've been approved to do what have case manager. So okay, I'm sure. I started getting my SSDI in 2014 due to cancer. Wow. But 2014, 10 years. So awesome, Vicky. You're still around with us. We appreciate it. We divorced after 33 years. I got spouse benefits 2 years ago when he got on SSDI. Could I have already started benefits off him when I first got on SSDI? He had to start his benefits. So unless he was 62 at that time. If he was 62, then yes, you could have gotten independently entitled divorce spouse benefits. If I'm on survivor benefits when I turn 65, will that be took from mine because my Social Security is lower that I receive? No, one offsets the other. But if you're on survivor benefits and you never touch the benefits on your own record, then your benefits are continuing to increase. So I would, call them up and say, did I start my benefits? If not, when are my benefits going to be more than my current benefits? And they'll tell you, oh, when you hit 67, they're going to be more. So maybe give them a call at that time. Never do Medicare Advantage. The care is less. Unfortunately, a lot of people, that's all they can do is they don't have the monthly premium. I wish if I was a dictator for a day, the second thing I would do is you wouldn't need a Medicare supplement, Medicare Advantage. Sorry, chapter, but it's a reality. I would make Part A cover all of those gaps. So there's 6 gaps in Part A and Part B. The big one is the 20% coinsurance in Part B. I would say let's do away with all those gaps in Part A and Part B, and then prescription drugs, and that's all you need. You don't need a Medicare Advantage or Medicare supplement. So, and yeah, people say that's the second thing you would do if you're a dictator for a day. All right, the regulars out there, what's the first thing I would do? The cure for male pattern baldness. Yay, very knowledgeable brokers that you recommend, much appreciated. Oh, awesome, good deal. When my wife Japanese heard you speak beautiful Japanese, her eyes bulged and jaw hit the floor. All right, じゃあ気をつけてね。ご主人のことも大事ですね。 All right. So can you keep survivor benefits even if you leave the US? Interesting. I remember hearing that was, oh, and by the way, thank you for the coffee money there. I appreciate it. Thank you very much. Domo arigato gozaimashita, or if you're from Osaka, Okini. So you keep survivor benefits even if you leave the USA. Interesting. I remember hearing that was the one exception. Didn't really understand what would make sense. Yeah, it has to be the totalization agreement for that particular country. And then if you ever, here's for anybody, the Japanese wife listening to everybody, um, for filing for benefits. If you're thinking about going overseas, a lot of people are retiring overseas right now because it's so cheap, in particular countries, and all they receive is Social Security. Get it done before you go, because you can file for benefits, retirement benefits, survivor benefits, and all that kind of stuff overseas at what's called the federal benefits units, which are in Social Security, excuse me, in embassy and consulate offices throughout the world. But it takes forever, and they're not really Social Security experts. Like in Asia, there's one. Jason, I don't think Jason is still there, and he's Manila. So there's a one Social Security employee at the embassy in Manila that takes care of all of Asia, Japan and Korea and China and Vietnam and Australia, and everybody else in the particular embassy just kind of assign that workload, get some training, but it's good to get all that stuff before you go, because it'll be a lot less of a hassle, and it'll be 10 times faster to get it. So I left a voicemail. I was wondering what you charge to go over Social Security and also disability. How long is your session? By mom and I. Yep. So just I'll put the link. It might already be in there. You'll see, was it called a link tree link type thing where it'll say more help here? Click on that, and you can go ahead and schedule an appointment. So I'm glad you mentioned that. What does offset mean in Social Security lingo? I see it on my war letter. Okay, perfect. Let's see. Every year I have panic attacks worrying about if I have the best benefits through Medicare. So I end up not doing anything. I will try to call chapter. Yes, perfect. And that's kind of, what the insurance companies want you, and then they're succeeding. I think the last I've seen is what 70% of people don't check their plans every year, Medicare Advantage and their Part D plans. And so the health insurance companies are going, yay, yay. So we can do whatever we want with these people, because those plans are only good for 1 year. Medicare Advantage, Part D plans, they're only good for 1 year. So, you have your plan ends December 31st, and a new plan starts January 1st. And you're like, no, it doesn't. I've had the same plan for years. No, you haven't. You've had the same plan for 11 months and 11 days. The plan you had last year, you might have the same card, and you might have the monthly premium the same, zero or whatever, you same doctor, and you think of the same company, but it's a different plan because they can change it, and they do change it every single year. And then they come up with a new plan. So the company that you have probably has 4, 5, 6, 7 different versions or so. And so you have, as I always say, you got you think you got the Corvette, but you actually got the Pinto. Or you maybe have the Corvette this year, but January 1st, you might have the Pinto if you don't check. So let's get you back into a Ferrari, I guess. All right. Anyway. Yeah. So no one called me back for an appointment with you. Thank you for service. Yeah, if you just leave a message, as I say in the voicemail, if you got Social Security questions, join my live Q&A. But yeah, if you want an appointment, you have to go ahead and schedule an appointment, and we can definitely talk. All right. Let's see. What are the questions? If you are 62, and then can you collect half of his? So yeah, if you're 62, you can collect a spouse benefits or an ex-spouse benefits, as long as your ex is at least 62, and as long as your ex's benefit is twice your full benefit amount. So can a man collecting SSD at Social Security Disability at 62 be able to collect survivor benefits from his at the same time? Yes. Thank you, Pat. Yes. A lot of people miss this. So again, if you're receiving disability benefits, if you're also eligible, survivor benefits start at 60. So, if that person has already been passed away, you've missed a couple of years of benefits. Um, but yeah, if you're receiving disability benefits, you can still get survivor benefits or spouse benefits if those benefits are available and it does not affect your disability at all. One offsets the other. So you'll get disability and survivor benefits and continue your Medicare and everything will be beautiful. Do you see any problems in the future with our benefits and healthcare? Retired teacher for 30 years receiving pensions, Social Security and Medicare, and A and B. My wife is teacher's aide and receives a small pension. I'm I'm an optimistic kind of guy, but yeah, something really needs to be done. I guess it depends on us. It is guaranteed that the Social Security Trust Fund, which the trust fund was built to be exhausted one day, it was built for the baby boomers coming up. It's just extra savings, the trust fund. But it's being depleted quicker. And so we're looking at about 2034 and then starting 2034 or possibly 2033 or earlier, possibly, we don't know. Then people will only get benefits based on what people pay that month. So the benefit you get July of 2033 will be based on who paid into Social Security that month. So if not enough people paid into Social Security in July of 2033, and it comes up with there's 30% shortage, then they're going to cut your check by 30%. That's how it works, unless we do something about it. Um, my, in my personal estimation, my opinion, which you all don't want to hear, my idea for it, which is a very popular idea out there, is to smash the cap. Is people that are high wage income workers, they don't pay all their income on in FICA taxes like the rest of us do. If you're making under 168,000, everything you make, you also have to pay FICA. But if you're making over that, you don't. So if someone makes a couple $1 million, they're paying less than 1% in FICA taxes, while we pay 15%. So I believe that we should get rid of that and everybody pays the same percentage. But that's not going to happen now, I don't think. Maybe it will. I don't know. Can you collect both spousal survivor benefits and Social Security disability? Yes. Yep. Already talked about that. It's so confusing. Yes, I agree with you. I'm 64 and will need to sign up for a Medicare soon. If I want to without future penalty, I have veterans health care. Should I opt out of Part D? All right. Good question on Veterans Day. I guess, yeah, I should answer a bunch of questions on Veterans Day, right? Veteran type questions. Okay. So with veterans, you have a lot of options. If you are 100% perfect with veterans health care and you live close by and it's going to be awesome service going forward, and you're not going to move to a place that doesn't have a good health clinic in your area, all kinds of different variables, then if that's the case, some people refuse Part B. I wouldn't recommend that. Because you never know what's going to happen with the VA in the future and budget cuts, and whether you move or you want a second opinion out in the the private healthcare. So here's an option: is you go ahead and get Part B, but the reason you're avoiding Part B because you don't want to have to pay the next year $185. I can see that. But there's a Medicare Advantage. I recommend Medicare supplements first, but in this case, Medicare Advantage. They're called Part B Give Back, and a lot of those have names, Patriot plans and Patriot and Honor plans that are kind of directed toward vets like you that use the VA predominantly. And what they are, most of them are Medicare Advantage only. They don't have Part D because Medicare, up until this year, they couldn't negotiate prices with pharmacy companies, pharmaceutical companies, but the VA can. So one part of the government can, the other it's yes. Anyway, don't get me started. So the veterans drugs are awesome, good prices, free, for a lot of people. So you can get a Medicare Advantage Part B give back, where the Medicare Advantage plan, if it's available in your area, can pay for your part of your Part B $50, $100, or all of it, depending on what's available in your area. So you get Part B and you get most of it or maybe all of it covered. You continue to get your drugs and stuff like that. And that way you're protected both ways and you avoid the penalty in case you do have to sign up in the future. So reach out to Chapter and they'll explain that a little bit more detail and see if there's one available in your area and how much it pays back. Can you confirm if our hardworking dollars have been spent on illegal migrants? Not Social Security. It's estimated that the reverse. So if everybody, what, $90 billion a year is paid into Social Security from people not working for working in the country not legally, so they will never get that money back because when they come to get their retirement benefits, Social Security employee says, "Well, we need your U.S. citizenship or your green card," and they say, "I don't have it." So, okay, well, thank you for the donation of $90 billion or so. So if those are kicked out, then the trust fund is going to be depleted earlier as well. So yeah, in order to get retirement benefits and disability benefits on your own record, you had to pay, and a lot of them do pay, incorrectly, illegally. They're the company they work for turns a blind eye, um, and but they'll never get that money back. So it's kind of like a donation. Thank you very much, I guess. I get survivor Social Security, but my CDR is in 5 years. Yep. So yeah, you'll still get it. Um, can you stop Medicare when you decide to retire abroad? Yeah, you can stop Medicare whenever you want, but I would definitely think long and hard. Are you really never coming back to the United States? If you know 100% for certain you're never coming back, the political situation in that country is going to be perfect. They're not going to kick you out. Like, anyway, some countries, changing laws and everything. Um, and you're not going to get homesick and you're not going to have to come home and, whatever the case may be. So you should, yes, you can, but please think long and hard to whether you should. Will those receiving benefits starting on January 2025 receive the COLA increase? Yes, everybody receives it at the same time. Husband and wife are 65. Wife has dementia. How does the husband sign up the wife for supplemental insurance? Yeah, call Chapter there, and they can definitely do it. They'll walk you through the legal thing. Power of attorney, or yeah, they'll whatever company. They'll look for the best company. They'll ask about the doctor. If it's a Medicare Advantage, they ask about the doctors and prescriptions and stuff like that. If it's for, okay, you said supplement. So yeah, so whatever company they require, if you're doing it for that person, they require, each company is a little bit different, but yeah, Chapter can walk you through and they can help you out. I meant to tell you, Shannon at Chapter did an excellent job and was a very kind young lady. Awesome. Appreciate you letting me know. Clarence Thomas. Hey, Clarence, hey, are you out in your RV there? Can an expat check back into the Social Security every 6 months to one per year and use some qualified Medicare Advantage programs with that range of infrequent residency requirements to use those plans? Legally, you kind of have to be living in that jurisdiction, because Medicare Advantage plans, they are zip code specific. And you're supposed to be a resident of that area, but there's some people that move around and you're on vacation. You don't live over there, you're just on vacation. So I'll just leave it at that. How's that? And that's why another reason I chose Chapter is because they've got that, member success team where you can ask specific questions based on your particular plan, whatever plan you have, because each company does it a tad bit differently. I have been disabled for years. Can she get benefits per my disability? No, nobody else. Well, she can't get disability based on your work, but if you are receiving disability benefits and she is 62 years old, then she might be entitled to benefits on your record, depending on how much benefits are on her record. I'm 63 and get SSDI now. Can my wife start to draw spousal benefits now? Yep. If your wife is at least 62 years old and your benefit amount is twice her benefit amount, then yes. Oh, Tweety Bird, no more coffee money. Character only. Okay. Thank you very much. I appreciate it. Thank you for your support. You guys are awesome today. Can I stop my Advantage plan and go back to my employer's plan for next year and then in 26 get on Medigap without physical? Oh gosh, it depends on your state, and because you started Part B, and it's usually with to avoid the health underwriting, they look at when you actually started Part B. But you can stop Part B for in terms of Social Security, you can stop Part B because you have health insurance from current work and your employer, I assume, has 20 or more employees. So the Part B is not the issue. Whether you can then switch to a Medigap when you restart it really depends on your state and the situation when you start it and everything like that. I'd reach out to chapter and they can look it up for your particular state and see if they can help you out, or whoever signed you up, they can help you out. We appreciate your ongoing service. So the amount showing on the Social Security website as to what my benefit amount will be when I turn 62 next year already reflects 15% cut. Um, so this is, yeah, pretty much. Because in the early 80s, under the Greenspan Commission, Reagan's Greenspan Commission, that's when they did all kinds of different things. And that's when they increased the retirement age. So anytime they increase the retirement age, every year longer you have to wait is essentially a 6.5% cut. So for 2 years, if you were born in 1960 and after, your full retirement age is 67. So not only do you have to wait 2 years, if you file for benefits at 62, 63, you're essentially also getting a 13% cut of your benefits as compared to someone who could get their benefits at 65. So that's another reason I don't like the idea of raising the retirement age up to 67. Okay. All right. I can understand that. But raising the retirement age to 68 or 69, which there's those proposals floating around out there. Yeah, I don't think so. Again, because it's not only raising the retirement age, but it's also giving a 6.5% cut for everyone. So my husband is on civil service and started collecting when he was 55 and decided to go back to work at 56 under Social Security. Can I collect his Social Security on top of mine? Yes. If his benefit amount is twice your benefit amount, then you go ahead and collect benefits on your record and then collect benefits on his record. Filed for Social Security in September. First check due this week. Contacted by company about a job now. I know I can stop Social Security and repay back any amounts like it never happened. Can I refile if job doesn't work? Yeah, absolutely. Yep. You withdraw, pay back the money if you already received it. If not, then you just withdraw it. And then 6 months later, didn't work out. Yep. Refile again. No problem whatsoever. It's a Medicare supplement plan. Do they change yearly? No, Medicare supplement plans, the plan F, G, and N, those are the same plans. It doesn't matter what company you get it from. A plan N is a plan N is a plan N. Doesn't matter what company. When you get a Medicare supplement, the two things you have to look at is pricing and the future of that pricing. So you want to get it. There's some companies out there in your area that, probably, East West Texas Firefighters Medicare Supplement Plan. Probably shy away from that. They probably have 37 members, and so they get you in there with a low ball, and then they jack up your price next year. So I'd get a company that's kind of nationwide, big respectable one. So I'm 73 years old, retired at 62, and was divorced at the time. Now currently receiving $12.40 a month. Is it too late for me to apply for SSI to support your income? No, you wouldn't be eligible for SSI. SSI is the welfare-based benefit. And for this year, it's only $943, and you make more than $943. So, all right, we are getting close to an hour, and we're running out of time. Let me get a couple of people that I don't think I've ever seen before. I don't think I've seen Erica. I'm planning on getting my divorced husband's 50% once he is full retirement age. Should I file first for mine and later change to divorce spouse benefits, or start with applying for both? Yeah, that's it really depends on your situation. What a lot of people do, that's called a split strategy. You're limited in terms of work if you file for benefits early, but what a lot of people do is the lower earning spouse goes ahead and collects the benefits on their own record. Sure, it's going to be reduced, but once your Well, this is a divorced husband, so you have to file for both. I thought it was a living. I thought it was your current spouse. So yeah, if once he is his yeah, his full retirement age is not relevant. It's your full retirement. So it doesn't matter when, if as long as he's 62, you can file for benefits on his record, and your benefit is based on his full benefit amount at his full retirement age. What is reducing your benefit is that you're filing early. So you have to file for benefits on your own record, and then you file for any spouse benefits you're eligible for. And if you're 62, then yeah, they're reduced. So it doesn't matter when he files. So, da, da, da. All right, we'll do one last question. When my husband passed, I was 57 years old. Now I just turned 64, still working. Do I have right for survivor benefits without touching mine? Yes, absolutely. But you're still working, so you have to stay under the annual earnings limit. Next year is what, the 23,400. As long as you stay under that, you can collect your survivor benefits. Don't touch your own record, your own benefits. Let your own benefits increase, and hopefully one day there will be more than survivor benefits. So, all right, that is it for today. I've got a lot of questions left over. I apologize. We're running out of time. I will be back again tomorrow. So cut and paste for tomorrow and pop it up first thing, and I guarantee I will get to you at that time. And y'all have an awesome day, and look out for those.